Hi, everyone. My name is Dia Buthandam. I'm a manager with Avia Health's Insights and Advisory Team. Avia is a member-based network of health systems and digital solution companies across the country, and we work very closely with our members to tackle the most pressing challenges in healthcare with innovative and transformative solutions. Today, I'm really excited to be joined by Lee Bienstock, CEO of DocGo, and really excited to dive in with Lee to learn more about DocGo, what you all do, and what you're seeing in your work today. And we are especially excited about the work that DocGo is doing because at Avia, from the days of our Medicaid transformation project a couple of years ago through the care transformation work that we continue to do, we view it as incredibly important to leverage digital to meet patients where they are with personalized whole person care. And so I don't want to share too much more. I want to let Lee do most of the talking, but I'm excited to jump in. And before we jump in on DocGo specifically and what you all do, would love to start with an introduction, Lee. Just hear more about yourself and your background and your time at DocGo.
Well, thank you, Dia. It's great to be here with you and Avia. Thanks for hosting us. I'm really excited to talk about the work our great teams are doing and obviously the transformation that's happening in the healthcare space, which is happening quickly. So a little bit about myself. My name is Lee Bienstock. I'm the CEO of DocGo. I joined DocGo in 2022 with the goal towards democratizing access to great patient care. We meet patients where they are when they need it. Prior to DocGo, I spent over 10 years at Google, actually democratizing access to information, right? So getting everybody in the world access to the information that they need and the services that they need. And really the spirit is the same here at DocGo. Our goal is to democratize access to great care to all patients that need it where they need it. And I'm really excited to share more about what our teams are doing here.
Great. Well, thank you for the overview. And yeah, let's just jump right in. For everyone that's coming across your platform for the first time, tell us a little bit more about what DocGo does. And also knowing that you work with a variety of different organizations and populations, how do you partner with those different organizations in the ecosystem to support those unique needs?
Yeah, great. So DocGo is a mobile healthcare medical transportation company. The company was started about 10 years ago. Actually, last year we served our 10 millionth patient. So we've been really operating at great scale. And really the whole goal of DocGo is to bring great care to where patients are, meeting them where they are, and of course, transporting them to the locations of care that they may need.
Mhm.
Last year, again, we're sitting here in February of 2026. In 2025, we helped transport over 700,000 patients last year across all our markets. We provided care in the home for over 150,000 patients by closing care gaps, preventative care, mobile labs in patients' homes. We monitored over 50,000 patients. And we acquired SteadyMD, which is a telehealth virtual care company operating in all 50 states. And they provided telehealth for over 1 million patients last year and lab reviews for 2 million lab orders. So we're really operating at great scale. Our whole goal is to be mobile and dynamic. We have a fleet of about 1,000 vehicles out in the field every single day across our markets, powered by our technology and 4,000 clinicians in the field every day, EMTs, paramedics, nurses, advanced practice providers, going and providing the care at the scale I was just describing. And really the core element is if you meet patients where they are, you're more likely to have better outcomes. And there's a big cohort of patients in this country. It's just sad to think about that the healthcare system is just failing right now. They're not getting the access that they need. And we have a different model. We deliver care, and we think that model is pretty innovative and allows us to reach patients that are being forgotten by the healthcare system today. The only way you can do that is with great technology. And really, at our core, we're also a technology company. We've built our own proprietary platform, which we could talk a lot more about, that allows us to manage that symphony of vehicles and resources and staff and heroes in the field with the right vehicle, with the right diagnostic, with the right licensure, all for the right patient need, all optimized in a way so that we can see the most number of patients we can with the highest quality. And that tech backbone is integrated with Epic. It's used by hospital systems. We use it to deliver care on behalf of payers and providers, and we're doing it at great scale.
That's incredible. Well, congratulations on all of those great achievements and your recent acquisitions as well. I know you mentioned that you've been around for 10 years, and in that time, you would know better than anyone that the market has seen really significant evolution in how we reach our patients, the data that we have coming in, and the tools that we have at our disposal to support our patients and, like you said, meet them where they are. And so knowing that you all have had a front row seat to that, tell us more about the evolution that you've seen in your company, what might have changed in those last 10 years for you all and what has stayed the same, and still remained at the core of what you all do.
Yeah, so what has really remained at the core and stayed the same is our technology ethos and enabling the teams in the field, the great heroes and paramedics and EMTs and nurses that are out serving patients, enable them with great technology that allows them to be more efficient and see more patients, and get the most out of their shift. And that's really been the core ethos of the company. We started with medical transportation. We work with leading hospital systems across the country. And really, we provide them with a technology platform. It integrates in their instance of Epic. It is integrated into their transfer center. It's part of the flow, part of their patient flow, which we can talk about. And we've been doing that since day one. As I mentioned, we've done it for millions of transports since we started. Hospital systems love it because it gives them transparency and visibility into patient flow, right? So they know exactly when the ambulance is arriving. Housekeeping knows exactly when to come and make that bed ready for the next patient, right? The receiving facility knows exactly when the patient's arriving. That digitization of the process is really core. That stayed the same. And we've brought that digitization of the process to the industry. We were pioneers in that 10 years ago, and we continue to add features that our hospital systems ask for so that they know exactly, as I said, when the ambulance is arriving, when to make the patient ready, when the bed is going to be ready for the next patient. And that bed management is a big, big aspect for hospital systems, right? Having reliable discharge medical transportation, interfacility transportation is not some bolt on to the hospital. It's integral into the flow of patients in and out of that hospital. And hospital systems are realizing that. That's why we work with some of the largest hospital systems out there: Jefferson, Mainline Health, New York City Health and Hospitals, Northwell, Methodist, HCA, and many others, where we partner and we help them manage the medical transportation and flow of patients. And they, again, have a digitized process where they can see exactly where the patient is in the patient life cycle, and not having that patient stay an extra night in the hospital when they don't need to because transportation didn't arrive, or patient was delayed for some reason, or there was not enough capacity to manage the patient flow. That extra night stay, oftentimes they're not being paid for. The bed needs to be freed up for the next patient. So that process is very value add for the hospital systems, and we embed deeply with them and we provide them with that technology. What has evolved for us, so that's been foundational to what we've done from day one, when the company was founded in 2015. Foundational. What has changed for us is we've started to apply that to a mobile healthcare uh, delivery method where we go and meet patients in their homes. Again, same logistical platform that we're using to manage the ambulances, we're also applying to mobile health units that are bringing the capabilities of a doctor's office into a patient's living room. And that, when you meet the patients where they are in their home, a lot of great, wonderful things happen for patient outcomes. And we're partnering with insurance companies that have patients that are impacting their HEDIS quality scores, that are frequent flyer to the ED, and we're helping with transitional care and care gap closure and preventative care in a patient's home. And these are the patients that they have not been successful in reaching. And we meet them where they are. We try a different method. Instead of trying to drive them into a clinic, we're meeting them in their home and bringing the power of the clinic and the capabilities of a clinic to them, doctor's office to them. And we're seeing really great outcomes and really great impact with that. We've been able, with one of our payer partners in California, we've been able to drop their hospital readmission rates, their ED readmission rates, their 30-day readmission rates by up to 50% for very, very acute cohort of patients, LACE scores of really 9 and 10. So out of a scale of 1 to 10. So we've really been doing a great job meeting patients where they are and applying the transportation, the medical transportation infrastructure that we have, applying it to a mobile healthcare delivery model.
Yeah, that's incredible and fascinating to hear, as we think about some of the work that we do at Avia around, orchestrating the patient journey and everything that wraps around with it. Know, to your point, how important it is that you're predicting and knowing specifically where the patient is at what point in their care journey and how, the entire wraparound service of your staff and team are, responding to that in real time. So definitely fascinating to hear about that evolution from being a, transportation service for health systems to now meeting patients where they are. And would love to chat more about that in a second as well. But hearing about some of the different value levers that you guys prioritize depending on the use case, would love to just chat a little bit more about, knowing that a lot of your clients that you serve likely have both a foot in the fee for service as well as the fee for value environment. How do you kind of articulate the value of DocGo across each of those different payment models?
Yeah, and it's a really important question because I think that is part of the trend of the industry of the healthcare space that's going to help us get to a better healthcare industry for all. But I think one of the most important insights, and I know you have a great membership base of hospital executives and really stakeholders and insurance company leaders. I think the big realization for us has been, and we hear it all the time, there's so many stakeholders in the healthcare industry where people are trying to sell them just software or just services. And particularly in the age of AI, where people are trying to sell in point solutions or they're creating great software, but how does it get implemented?
Yep.
Or there's a way to sort of say, hey, we can help you provide great care, but it's not really tech enabled or the way that hospital systems or payers want to move their organizations. And we've really hit on what I think is not easy to do, but I think is really table stakes, which is we really provide the software and the services integrated into one. And our view is, particularly in the age of AI, particularly in the age of the digitization, the continued innovation in the healthcare space, I think stakeholders within the healthcare industry are going to need ways to both maybe utilize software, but then also implement it. And so that's been the big sort of unlock for us is we build our own software, we have our own tech platform, but we also provide the boots on the ground and the vertical integration that allows us to also deliver the services. And I think that's a very big component. And that is a big strategy that we think is going to be successful because it's going to be very difficult to implement software alone without having the personnel and the service delivery arm to be able to effectuate and get the most out of what technology has to offer. And so for us, we've again built that vertical integration. It's the technology, it's embedded in their instance of Epic, and then we also provide the boots on the ground and the personnel to actually deliver the services, deliver the medical transportation, deliver the care in the home. And so again, we operate both in a fee-for-service and increasingly value-based world, where on a fee-for-service basis, we've really been able to help hospital systems collect on trips where perhaps they're the payer of last resort, but we've been able to integrate with their instance of Epic and make sure that all the insurance information is being collected at the time of service. And then most of the services that we're offering are really anchored around a value-based offering where we're helping increase the quality scores of insurance companies, right? We're helping address patients that are costing the system a lot of money, but we're bringing preventative services to them in their home and reaching them where they are. One of the great examples I give is in a value-based world, one of the care gaps that we do in the home is a bone density scan for osteoporosis patients.
Mm-hmm.
And it's the same bone density scan that gets done in the doctor's office, except we're bringing it into the living room of the patient. And when we're there with that patient, we get a chance to see not only what their bone density score is, but we also get to see, well, wait a second, actually, there's loose carpeting all over their house. Oh, wait a second, like the pavement outside their home is cracked. Their bedroom is on the second floor of the home, and the stairs are really steep. Right. So not only are we understanding perhaps what their bone density score is, and yes, how big of a risk they are if they fall to break a bone and perhaps become immobile, but we also understand their social determinants of health. We also understand their home environment, and we help them perhaps maybe able to manage those other factors that could also lead to the patient sort of having a precipitating condition or a crisis, which obviously will also cost the system a lot of money. So we're in a way able to help the insurance companies get a much bigger 360-degree view of the patient, which is what you need to be really successful in a value-based arrangement. It's one thing to get the score to do the scan or to do the care gap. It's another thing to really understand the insight into that patient's home life and really their risk factors. And going into the home gives you a much deeper view of that patient. And we think that insight into the patient will help you reduce the cost, improve patient outcomes, and that's what it takes to be successful in a value-based world.
Absolutely. I love that example of, checking their carpeting, seeing what the pavement looks like to just get all those minute details that are so important for the patient health that we don't necessarily do the best job of today as a broader healthcare system of really paying attention to. So love that example. I know you mentioned that in addition to being a tech service, you do, really emphasize and prioritize the implementation and the operational support as a part of that. Could you talk a little bit more about, what those steps you take are when you partner with a health system to really ensure that you are, a sustainable solution that's embedded into their workflows, and what steps you take to really partner with them beyond just being a tech partner?
Yeah, so oftentimes when a hospital system is partnering with us, the old way they were doing it is relying on a cadre of different vendors and different medical transportation providers, and then maybe they have a call list and they call the first medical transportation provider if they're not available, which by the way, oftentimes when the patient has Medicaid or no insurance, every medical transportation company just happens to not be available, right? And so
Yeah.
we basically go from that world where they're managing a cadre of vendors to a world where everything is integrated and we provide them with the capacity that they need to manage their patient flow. And what that means is we take our tech platform, our computer-aided dispatching system, our medical transportation ordering platform, and we embed that into their instance of Epic. And what that allows them to do is to order medical transportation. The discharge nurse can order medical transportation directly from the patient's chart in Epic. So that gives us their condition. That gives us perhaps medical necessity. Do they even need to be transported by ambulance? Their insurance information, and of course, where and when the pickup needs to happen. All again integrated into their instance of Epic through our tech platform. And then the discharging nurse gets to see exactly when we're arriving, when to make that patient ready. So when we show up, we're not sitting around waiting for the patient to be ready, and we can be super efficient. So that's the first piece. We provide them with that tech platform. It gets integrated within Epic. We do that in a matter of weeks. We're very proficient with that at this point. We've done that at Jefferson, New York City Health and Hospitals, lots of our other partners, and that tech platform is embedded. Now, when we can run the trip, we run the trip with our crews in the field. If they're
Mhm.
having surge moment, we also have a brokering platform that we can then subcontract out the trips to other providers. So again, we're basically digitizing that process and ensuring they have full capacity. And that's basically our platform. We take over and partner with them to work in their transfer center, to integrate our software, and to also provide them with the crews that they need. And when they have that surge moment, we have a cadre of other partners in their markets that we can also send the trips out to so that they're covered and they don't have to worry about managing a cadre of vendors. We handle that all for them. And we see much more efficiency. Patients get moved when they're supposed to be moved. We can prioritize whichever patients the hospital systems want us to. Oftentimes, the ambulances are co-branded or branded the hospital system. It's a much more first-party like experience than managing a bunch of vendors as sort of a third-party solution. And our hospital systems, absolutely love it. We've been working with our hospital systems, many of which is 2017, 2018, on our third, fourth, fifth iteration of various different, partnerships that we have with them. And so it's been going very well.
Great. That's a great overview. Before we wrap our conversation, reaching the end of it, I think, a great call to action or just a way to, close would just be hearing from you why it's important that we act now. I know that, most recently we are seeing, of course, labor shortages and other challenges that make it really hard for health systems to reach the patients they need to reach. And as a result, as you mentioned, a lot of inequitable access for our patient populations. But from your perspective and in your words, why is it so important that we act now?
Yeah, well, something needs to happen. We can't keep going the way we're going with healthcare in this country, right? I mean, 1 out of 4 Americans doesn't have a primary care provider or know who they are. You have over 160 million Americans that are living with one or more chronic conditions. We're seeing from all the payers that they're strained on their MLRs, their medical costs are going up. And so the only way to really be successful is to try and impact patient outcomes
Mhm.
meet patients where they are, close gaps in care so they lead healthier lives. When they lead healthier lives, it'll cost the system less money, plain and simple. And that's really what we set up our company to do. We go and meet patients where they are, and we certainly don't want them spending extra nights in the hospital or having delays of discharge because there wasn't adequate medical transportation. And so we really help our ecosystem partners. We're trying to make our hospital systems more profitable. We're trying to help them be more sustainable. We're trying to help them deliver better patient care. We're trying to help our insurance company partners lower their total cost of care, meet their patients where they are, particularly the ones that have been drifting, that are unattached, that are costing them a lot of money. And if we're successful, we can help stem the tide of rising costs and worsening outcomes with patients. The time is not now. The time was yesterday, but we can't change the past, so we can only do it in the moment. And I think, something has to happen, and we're leading that revolution uh, with our partners on the hospital system side and the insurance side.
Absolutely. Yeah, I love that. The time is not now. The time was definitely yesterday, but
Yeah.
excited about the work that you all are doing. Thank you so much for your time, Lee. Before we wrap, want to just check in with you. Is there anything else you want to share in terms of upcoming conferences or resources you'd like viewers to point their attention to as they, look to learn more about DocGo?
Yeah, I think first off, really appreciate you having us. And I know you have a great membership base, and that was a great conversation. I do want to call out some of the conferences that we will be at since you asked. We definitely want to spend more time in the industry. So we will be at the American Case Management Association Conference in Eastern Pennsylvania on February 28th in Bethlehem, Pennsylvania. We'll be at the National Association of Mobile Integrated Healthcare Providers Summit in Scottsdale, Arizona in March. In April, we'll be at the American Ambulance Association annual conference, and also in April in Orlando, we'll be at the American Case Management Association national conference. So we are out there. We're always excited to speak to people and meet new people and new systems perhaps that we can partner with. And our teams are going to be doing a great job, not only getting out and serving patients, but also attending some industry conferences.
That's awesome. Well, now you know where to find them. And for those that are viewing, you can also learn more about DocGo from their website as well as our Avia Marketplace platform. And we will add a link to both of those at the end of this video so you can find those pretty easily. But Lee, so great to speak with you. Thank you again for your time and excited to stay updated on what comes next.
Thank you, Dia. Appreciate it.
Great.
Be well.
All right. Well, I will stop the recording.
Great.